Imagine this. You're at home, the door is locked, the phone is just out of reach, and in one shattering moment, a crushing weight slams down on your chest. This is the nightmare scenario that over 380,000 Americans face every year, a cardiac event completely alone. For most, panic sets in, and the first critical minute is lost. But for a select few, for those who are prepared, that minute becomes the difference between life and death. I'm here to tell you something groundbreaking. Research published in the European Heart Journal revealed that individuals over 60 who executed the correct steps in the first 60 seconds of a heart attack increased their chance of survival by a staggering 73%. That is the power of knowledge. We are moving beyond simple tips. We are detailing the 10 advanced survival protocols that turn a victim into a survivor. This isn't common knowledge. This is the protocol now being taught to emergency dispatchers. Stay with me, because protocol number 9 is so powerful. It's like having a paramedic right there in your living room. Before we even start, do you know the single most common mistake people make that instantly halves their survival odds? It's not about aspirin. Drop your guess in the comments below, and we'll reveal the answer in section 4. Protocol number 1. Establish your redundancy communication system. When your brain is oxygen deprived, and it will be, cognitive function plummets. Studies show that up to 2/3 of cardiac event survivors struggle to recall their own address or even dial the full 911 sequence. Here is the actionable strategy. Physical address card. Immediately print or write your full address, including apartment number and gate codes, on a bright, laminated card. Tape it directly next to every landline in your home. Speed dial 1. Program the emergency number 911/999/112 into your speed dial as 1 on every phone. When your hands are shaking, hitting 1 button is infinitely faster than 3. Voice activation mastery. Practice using voice activation. Set up a simple command like call emergency that initiates the call to help. How often is your cell phone charging in a different room when you go to bed? Statistics show that over 40% of fatal heart attacks in seniors happen overnight. What simple item should you put in your nightstand tonight to keep your phone close? Hint, it's not a charger. Protocol number 2. The first action must be the unlocked door. This is a chilling reality. Paramedics often arrive in time, but are delayed by a locked door. One study tracked over 8,000 emergencies and found that locked doors delayed treatment by an average of 11 crucial minutes. The survival window slams shut in 3 to 5 minutes. You must assume you have just 1 minute of full strength. The instant response. The moment you feel symptoms, walk immediately to your door, unlock it, and leave it slightly ajar or unlocked. Do this before you call 911. Once you're down, you won't get back up. External signal system. Invest in an approved medical key lockbox. Give the code to your local fire department for immediate, non-destructive access. Visibility queue. Turn on every single light in your home, even during the day. An emergency responder will spot a fully illuminated house instantly, saving precious minutes of searching for the correct address. If you live in an apartment building, relying on 911 alone is a mistake. What other essential person should you call immediately after the emergency services to guarantee a clear path for medics? Protocol number 3. Mastering the aspirin absorption technique. You know to take aspirin, but knowing how to take it is the difference between a minor benefit and a life-saving intervention. The single most common mistake we mentioned earlier? It's swallowing the pill whole. The Harvard Heart Letter confirmed that the way you consume aspirin can make it work 50% faster. The chew, don't swallow rule. You must chew the aspirin. Chewing breaks the tablet and allows the medication to be absorbed through the blood-rich lining of your mouth, bypassing the slow dissolution process in your stomach. This can shave up to 12 minutes off the time it takes to reach therapeutic blood levels. The correct dose. The acute event dose is generally 325 milligrams, 1 adult tablet, or 481 milligrams, baby aspirins. If you are already on a daily preventive dose, you must take the additional full emergency dose. Storage check. Aspirin degrades quickly when exposed to moisture. Store non-coated aspirin in its original container and replace it every 6 months. If you only have enteric-coated aspirin, should you still chew it, or is swallowing better? This is a point of contention for many. What does the research say? Protocol number 4, the controlled cough CPR technique. This technique is often controversial, but the science is clear on its proper, limited use. It is not a substitute for 9/11, but a temporary measure to maintain consciousness. Cough CPR works by generating pressure changes that can temporarily keep blood flowing to your brain when your heart's rhythm is irregular. The key is to buy you precious seconds to call 911 or reach your medication. The precise, life-extending method. The deep breath. Take a deep breath, filling your lungs completely. The forceful cough. Cough hard and deep, exactly as if you were trying to cough up phlegm from deep in your chest. The cough must originate from your diaphragm, not your throat. The rhythm. Repeat the cycle. Deep breath, forceful cough, every 2 seconds, without stopping. This rhythm manually squeezes the heart. Cough CPR is only effective in a narrow window and for specific types of rhythm issues. If you have a total arterial blockage, the classic heart attack, using this technique could actually be detrimental. Why is the act of forceful coughing only helpful if you are still conscious? Protocol number 5. Assume the semi-Fowler's cardiac position. Your body's posture during a cardiac event can directly affect the workload on your heart and the oxygen saturation in your blood. Lying flat is one of the worst things you can do. When you are in distress, you must reduce the heart's workload. The 45-degree rule. Immediately sit up at a 45-degree angle. Prop yourself up against a wall or stack pillows on a bed or couch. Your knees should be bent, with feet flat. The physiological benefit. This position uses gravity to help blood flow, minimizes fluid backup in the lungs, and allows your diaphragm to expand fully, making breathing easier. Research shows this position can maintain better oxygen saturation levels. The fallback. If you feel dizzy or about to faint, slowly lower yourself to the floor and roll onto your side, the recovery position. This keeps the airway open and prevents choking if vomiting occurs. Beyond just your position, what simple, immediate action related to your clothing can improve your blood oxygen levels by nearly 8%? Think about constriction. We are halfway through the 10 protocols, and the most critical information, the nitroglycerin protocol, is still ahead. If you found this information valuable, please hit the like button right now. That simple click tells YouTube that this video is important, and it pushes this life-saving knowledge out to more seniors who are alone and need to be prepared. Subscribe to the channel so you don't miss our upcoming deep dive on stroke prevention. Protocol number 6, the 4-4-6 controlled diaphragmatic breathing. When pain hits, your natural instinct is to hyperventilate, rapid, shallow breaths. This panic response accelerates your heart rate, increases your heart's oxygen demand, and makes everything worse. Controlled breathing is a powerful, non-pharmacological tool to activate your parasympathetic nervous system, slowing your heart rate and lowering blood pressure. Focus on the belly. Place one hand on your chest and one on your belly. The hand on your belly must move more than the hand on your chest. The 4-4-6 rhythm. Inhale slowly through your nose for a count of 4, belly expands. Hold for a count of 4. Exhale slowly through pursed lips for a count of 6, belly contracts. Practice is preparation. Research shows those who practice this technique for just 5 minutes daily have a much higher success rate using it during an emergency. Why is the exhale, the count of 6, the most important part of this exercise? What specific branch of your nervous system are you trying to activate with the longer exhale? Protocol number 7. Symptom recognition beyond the Hollywood heart attack. Many seniors miss the critical window because they expect the classic clutching the chest scenario. For women and older adults, symptoms are often subtle, confusing, and nonspecific. To survive, you must know the full spectrum of silent or atypical warnings. The hidden symptoms. Look for shortness of breath without exertion, pain in the jaw, neck, or upper back, often mistaken for arthritis, and extreme, sudden fatigue. Digestive deception, nausea, vomiting, or what feels like bad indigestion or heartburn, especially if it's not relieved by antacids. The prodrome phase. These non-chest pain symptoms often occur days or even weeks before the major event. If you experience these, treat it as a warning and contact your physician immediately. If you suddenly break into a cold sweat while sitting still, and that feeling is accompanied by a sense of impending doom, you are likely experiencing an acute cardiac event. Why is a simple symptom like cold sweat such a reliable physiological alarm for cardiologists? This is it. Protocol number 8, the immediate nitroglycerin dosing protocol. This is the survival action that the Harvard study found could give you survival rates nearly identical to those who had immediate paramedic intervention. The key, however, is the correct protocol. Nitroglycerin, NTG, is a powerful vasodilator, relaxing your blood vessels to reduce the heart's workload and improve blood flow. It can literally arrest a heart attack in its tracks if the blockage isn't total. Sit down first. Never take any G while standing. It can drop your blood pressure so fast that you faint and injure yourself. The sublingual rule. Place one tablet directly under your tongue, sublingual. Let it dissolve completely. Do not swallow. A tingling or burning sensation means it's working. The 5-minute timer. Set a timer for 5 minutes. If symptoms persist, take a second tablet. Wait another 5 minutes. If symptoms still persist, take a third tablet and then call 911 if you haven't already. Never exceed 3 tablets in a 15-minute period. This is crucial. If you have taken any erectile dysfunction medication, like Cialis or Viagra, in the last 24 to 48 hours, you must not take nitroglycerin. What fatal physiological event does this drug combination cause? We are now at protocol number 9, the emergency information blueprint. The average time a paramedic spends gathering essential information like medications and allergies upon arrival is a critical point of delay. You can eliminate this delay entirely with one simple, organized document. This document is your silent translator when you are unable to speak. The single sheet principle. Use a single, easy-to-read, typed, or clearly printed document. Include your full name, birth date, blood type, and the primary contact person and their number. Medication matrix. List every single medication you take, including over-the-counter supplements and their exact dosages. Also, list any known allergies, especially to drugs like penicillin or aspirin. The location. Tape this sheet to the inside of your front door at eye level. The American College of Emergency Physicians confirms that visible medical information reduces treatment delays by over 25%. This is the first thing medics will see once they are inside. Laminate it if possible to protect it from moisture. Think about the last time you saw a doctor. Did they ask you about your supplements? Why is including your non-prescription supplements on this emergency sheet almost as important as listing your primary heart medication? Finally, protocol number 10, establish your post-crisis survival network. Survival is often measured in the minutes, hours, and days immediately following the acute event. Your family and friends are an essential part of your defense system. This protocol focuses on prevention through accountability. The point person. Designate a single, trusted neighbor or family member as your emergency point person. They must have a spare key, a copy of your emergency information sheet, Protocol 9, and the codes to your medical lockbox. The check-in routine. If you live alone, establish a daily, I'm okay check-in routine. A text, a phone call, or simply opening your blinds at a specific time. If you miss that window, your point person knows to escalate to a wellness check. The hospital kit. Pre-pack a small duffel bag or backpack with insurance cards, advanced directives, if applicable, phone chargers, and comfortable clothes. Keep this by your door so that in the event of an emergency transport, someone can grab it quickly. If you were rushed to the hospital right now, who would know which medications you took this morning? Reach out to your chosen point person today and share this information. Why is the fear of being a burden often the biggest obstacle to setting up this network? You have now mastered the 10 advanced survival protocols, the knowledge that can genuinely be the difference between life and death during a cardiac event when you are alone. This preparation is a gift, not just to yourself, but to the people who love you. I need you to take action right now to solidify this knowledge. Take 5 minutes today to start on Protocol 9. Write down your name and address and tape it next to your phone. Don't put it off until tomorrow. If this detailed, evidence-based approach gave you more confidence and peace of mind, please hit the like button right now. Every like pushes this critical information higher in the search results, directly reaching someone who might be searching for this help in their darkest hour. Community and sharing. If you or a loved one has survived a heart attack alone, share your single most important lesson in the comments below. Your experience could be the final, life-saving piece of advice for another person watching this video. Subscribe to the channel and ring the notification bell. In our very next video, we're diving into the 5 silent warning signs of stroke, another critical health threat that requires immediate, prepared action. Stay prepared, stay resilient, and thank you for committing to your own survival.